Hello, nursing students. Welcome to Nursing Exam Preparation, your ultimate resource for excelling in nursing exams with confidence. In today's video, we'll take you through 150 multiple-choice questions, MCQs, on malaria, each carefully crafted to challenge your knowledge and deepen your understanding of this crucial topic. Detailed explanations follow every question, helping you not only select the correct answer, but also understand the reasoning behind it. Whether you're just starting your studies or reviewing for exams, this video is packed with content designed to test your skills, sharpen your critical thinking, and reinforce key concepts related to malaria. Don't forget to like this video, share it with your fellow students, and subscribe to Nursing Exam Preparation for more valuable resources. Be sure to hit the bell icon to stay updated on our latest videos, all aimed at helping you succeed. Once you've finished the video, let us know your score in the comments below. We'd love to hear how you did. Let's get started and work together to master malaria and achieve exam success. 1. Which of the following is the vector responsible for transmitting malaria? A. Tsetse fly. B. Anopheles mosquito. C. Triatamine bug. D. Aedes mosquito. Answer: B. Anopheles mosquito. Rationale: the Anopheles mosquito is the sole vector responsible for transmitting malaria, specifically through the bite of the female mosquito, which injects sporozoites into the bloodstream. The other options, such as the tsetse fly, A, triatamine bug, C, and Aedes mosquito, D, are not associated with the transmission of malaria. 2. Which stage of the Plasmodium parasite is responsible for the initial infection in humans? A. Schizont. B. Trophozoite. C. Sporozoite. D. Merozoite. Answer: C. Sporozoite. Rationale: the sporozoite is the infectious form of the Plasmodium parasite, which is injected into the human bloodstream by the Anopheles mosquito. The sporozoites travel to the liver where they mature. Schizonts, A, trophozoites, B, and merozoites, D, are later stages in the parasite's life cycle that develop after the initial infection. 3. Which of the following is the most common cause of severe malaria? A. Plasmodium vivax. B. Plasmodium malariae. C. Plasmodium falciparum. D. Plasmodium ovale. Answer: C. Plasmodium falciparum. Rationale: Plasmodium falciparum is the most virulent and common cause of severe malaria, leading to complications such as cerebral malaria, organ failure, and death. P. vivax, A, P. malariae, B, and P. ovale, D, are less likely to cause severe malaria. 4. A patient presents with fever, chills, and sweating that occur in cyclical patterns. Which phase of malaria is associated with these symptoms? A. Liver phase. B. Erythrocytic phase. C. Sporogonic phase. D. Exoerythrocytic phase. Answer: B. Erythrocytic phase. Rationale: the cyclical fever, chills, and sweating are characteristic of the erythrocytic phase of malaria, where merozoites invade red blood cells, causing their rupture and the release of waste products. The liver phase, A, sporogonic phase, C, and exoerythrocytic phase, D, do not cause these symptoms as they occur in different stages of the parasite life cycle. 5. What diagnostic test is commonly used to confirm the diagnosis of malaria? A. CT scan. B. Blood smear. C. Urinalysis. D. Chest X-ray. Answer: B. Blood smear. Rationale: a blood smear is the gold standard for diagnosing malaria. It allows identification of the Plasmodium parasite in red blood cells. CT scans, A, urinalysis, C, and chest X-rays, D, are not used for diagnosing malaria. 6. Which of the following is the primary treatment for uncomplicated malaria caused by Plasmodium falciparum in areas with chloroquine resistance? A. Quinine. B. Artemisinin-based combination therapy, ACT. C. Chloroquine. D. Mefloquine. Answer: B. Artemisinin-based combination therapy, ACT. Rationale: artemisinin-based combination therapy, ACT, is the primary treatment for uncomplicated malaria caused by P. falciparum, especially in areas with chloroquine resistance. Quinine, A, chloroquine, C, and mefloquine, D, are less effective in such areas. 7. Which of the following is a major complication of malaria that can lead to life-threatening consequences? A. Jaundice. B. Cerebral malaria. C. Hemorrhoids. D. Pneumonia. Answer: B. Cerebral malaria. Rationale: cerebral malaria is a severe complication of malaria caused by P. falciparum, and it can result in neurological impairment, coma, and death. Jaundice: A. can occur in malaria, but is less life-threatening. Hemorrhoids, C. and pneumonia, D. are unrelated to malaria. 8. Which malaria prevention strategy is most effective in preventing malaria transmission in endemic areas? A. Use of insecticide-treated bed nets. B. Taking daily chloroquine. C. Wearing protective clothing. D. Eating garlic. Answer: A. Use of insecticide-treated bed nets. Rationale: the use of insecticide-treated bed nets is one of the most effective strategies in preventing malaria transmission by reducing mosquito bites during sleep. Taking chloroquine, B. as a prophylaxis, or wearing protective clothing, C. are less effective in the long term. Garlic, D. is not a scientifically supported method of prevention. 9. Which of the following populations is at highest risk for severe malaria? A. Elderly adults. B. Pregnant women. C. Adolescents. D. People with asthma. Answer: B. Pregnant women. Rationale: pregnant women are at high risk for severe malaria, including complications like anemia, fetal death, and preterm birth. The elderly, A. adolescents, C. and individuals with asthma, D. are not at the same heightened risk for severe malaria as pregnant women. 10. Which of the following statements about malaria eradication efforts is true? A. Malaria has been eradicated globally. B. The World Health Organization is focused on elimination in certain areas. C. Malaria transmission is no longer a concern in sub-Saharan Africa. D. The global burden of malaria has been fully addressed. Answer: B. The World Health Organization is focused on elimination in certain areas. Rationale: the World Health Organization has made significant efforts to eliminate malaria in certain areas, but global eradication has not been achieved. Malaria is still prevalent in many parts of sub-Saharan Africa and other tropical regions. Therefore, statements A, C, and D are incorrect. 11. Which of the following is the vector responsible for transmitting malaria? A. Hepatitis B. B. Anopheles mosquito. C. Pneumocystis jirovecii. D. Toxoplasma gondii. Answer: B. Anopheles mosquito. Rationale: the Anopheles mosquito is the primary vector that transmits malaria. Hepatitis B, A, Pneumocystis jirovecii, C, and Toxoplasma gondii, D, are unrelated to malaria transmission. 12. What is the first-line treatment for uncomplicated malaria caused by Plasmodium falciparum in areas with chloroquine resistance? A. Artemisinin-based combination therapy, ACT. B. Chloroquine. C. Primaquine. D. Quinine. Answer: A. Artemisinin-based combination therapy, ACT. Rationale: artemisinin-based combination therapy, ACT, is the first-line treatment in areas with chloroquine-resistant malaria. Chloroquine, B, is ineffective in these areas, while primaquine, C, and quinine, D, are used for specific indications but not as first-line treatments. 13. A malaria infection is most commonly transmitted by which of the following? A. Direct contact with an infected person. B. Sexual contact. C. Blood transfusion. D. Anopheles mosquito bite. Answer: D. Anopheles mosquito bite. Rationale: malaria is primarily transmitted through the bite of an infected Anopheles mosquito. The other options, A, B, C, are not common routes of malaria transmission. 14. Which of the following malaria species is most commonly associated with relapse? A. Plasmodium falciparum. B. Plasmodium vivax. C. Plasmodium malariae. D. Plasmodium ovale. Answer: B. Plasmodium vivax. Rationale: Plasmodium vivax is known to cause relapsing malaria due to the dormant liver stage, hypnozoites. P. falciparum, A, P. malariae, C, and P. ovale, D, do not commonly cause relapse. 15. A patient with malaria presents with hemolysis, jaundice, and fever. These symptoms are most consistent with which complication of malaria? A. Cerebral malaria. B. Anemia. C. Renal failure. D. Liver failure. Answer: B. Anemia. Rationale: hemolysis, jaundice, and fever are common signs of anemia in malaria due to the destruction of red blood cells by the parasite. Cerebral malaria, A. Renal failure, C. And liver failure, D. Are other complications, but are less likely to present with this combination of symptoms. 16. Which of the following is a diagnostic method used to detect malaria infection? A. Blood culture. B. Blood smear. C. Serum electrolyte test. D. Chest X-ray. Answer: B. Blood smear. Rationale: a blood smear is the primary diagnostic method for malaria, allowing identification of Plasmodium parasites in red blood cells. Blood cultures, A. Serum electrolyte tests, C. And chest X-rays, D. Are not used for diagnosing malaria. 17. What is the primary cause of malaria-related mortality worldwide? A. Severe anemia. B. Cerebral malaria. C. Kidney failure. D. Respiratory distress. Answer: B. Cerebral malaria. Rationale: cerebral malaria, caused by Plasmodium falciparum, is the leading cause of malaria-related mortality due to its severe neurological effects. Severe anemia, A. Kidney failure, C. And respiratory distress, D. Can be complications, but they are less common as causes of death. 18. Which of the following medications is typically used for malaria prophylaxis in travelers to endemic areas? A. Azithromycin. B. Chloroquine. C. Doxycycline. D. Amoxicillin. Answer: C. Doxycycline. Rationale: doxycycline is commonly used for malaria prophylaxis in travelers to endemic areas. Chloroquine, B. is another option but may not be effective in areas with resistance. Azithromycin, A. and amoxicillin, D. are not effective for malaria prevention. 19. In which of the following regions is malaria most endemic? A. Western Europe. B. Sub-Saharan Africa. C. North America. D. Australia. Answer: B. Sub-Saharan Africa. Rationale: malaria is most prevalent in Sub-Saharan Africa, which bears the highest burden of the disease. Western Europe, A. North America, C. And Australia, D. have minimal malaria transmission. 20. Which of the following is the most common method of malaria transmission to humans? A. Contaminated food. B. Infected mosquito bite. C. Blood transfusion. D. Sexual transmission. Answer: B. Infected mosquito bite. Rationale: malaria is primarily transmitted through the bite of an infected Anopheles mosquito. Contaminated food, A. Blood transfusion, C. And sexual transmission, D. are not common methods of malaria transmission. 21. Which population is at greatest risk for malaria complications during pregnancy? A. Adolescents. B. Pregnant women. C. Children under 5. D. Elderly adults. Answer: B. Pregnant women. Rationale: pregnant women are at high risk for severe malaria complications, including anemia, fetal death, and preterm birth. The other populations, A, C, D, are not as vulnerable to the same degree. 22. What is the primary site of action for antimalarial drugs such as chloroquine and artemisinin? A. Liver. B. Red blood cells. C. Intestines. D. Mosquitoes. Answer: B. Red blood cells. Rationale: antimalarial drugs like chloroquine and artemisinin target the red blood cells where the malaria parasite undergoes its erythrocytic cycle. The liver, A, and intestines, C, are involved in other stages, and mosquitoes, D, are the vector, not the site of drug action. 23. What is the most effective method of preventing malaria transmission at night? A. Using insecticide-treated bed nets. B. Taking malaria medications before travel. C. Wearing long-sleeved clothing. D. Spraying insecticides indoors. Answer: A. Using insecticide-treated bed nets. Rationale: insecticide-treated bed nets are the most effective method of preventing mosquito bites during sleep, the time when malaria transmission occurs. Other methods like medications B, clothing C, and indoor spraying D are useful but less effective. 24. Which of the following antimalarial drugs is most commonly used to treat liver hypnozoite forms of Plasmodium vivax? A. Quinine. B. Primaquine. C. Artemisinin. D. Mefloquine. Answer: B. Primaquine. Rationale: Primaquine is used to treat liver hypnozoite forms of Plasmodium vivax to prevent relapse. Quinine A, artemisinin C, and mefloquine D are not effective for this purpose. 25. Which of the following diagnostic tests is used to detect malaria quickly, especially in remote areas with limited resources? A. Rapid diagnostic test, RDT. B. Blood culture. C. Liver function test. D. PCR test. Answer: A. Rapid diagnostic test, RDT. Rationale: Rapid diagnostic tests, RDTs, are often used in resource-limited settings to quickly diagnose malaria. Blood cultures, B, liver function tests, C, and PCR tests, D, are more specialized and not used for quick diagnosis in the field. 26. Which of the following species of Plasmodium is associated with the longest incubation period before symptoms appear? A. Plasmodium vivax. B. Plasmodium falciparum. C. Plasmodium malariae. D. Plasmodium ovale. Answer: A. Plasmodium vivax. Rationale: Plasmodium vivax has the longest incubation period, typically 12 to 17 days before symptoms appear. Plasmodium falciparum B, malariae C, and ovale D have shorter incubation periods. 27. Which of the following statements about malaria transmission is true? A. Malaria can be transmitted by direct contact. B. Malaria is transmitted only during the day. C. Malaria is transmitted by mosquitoes. D. Malaria can be transmitted by respiratory droplets. Answer: C. Malaria is transmitted by mosquitoes. Rationale: Malaria is transmitted by the bite of an infected mosquito, specifically the Anopheles species. Direct contact A, daytime transmission B, and respiratory droplets D are not modes of transmission for malaria. 28. Which of the following antimalarial drugs is used primarily for treatment of severe malaria caused by Plasmodium falciparum? A. Artemisinin-based combination therapy, ACT. B. Mefloquine. C. Primaquine. D. Quinine. Answer: D. Quinine. Rationale: Quinine is typically used for severe malaria caused by Plasmodium falciparum, often in combination with other drugs. ACT A is used for uncomplicated malaria, while mefloquine B and primaquine C are used for specific indications. 29. Which of the following is not a key feature of malaria caused by Plasmodium falciparum? A. High fever. B. Cyclical chills and sweats. C. Cerebral malaria. D. Hypoglycemia. Answer: D. Hypoglycemia. Rationale: While high fever A, cyclical chills and sweats B, and cerebral malaria C are characteristic of P. falciparum infection, hypoglycemia D is not a common feature of the disease. 30. What is the role of the spleen in the pathophysiology of malaria? A. The spleen filters out infected red blood cells. B. The spleen produces antibodies to fight malaria. C. The spleen harbors parasites. D. The spleen stores excess glucose. Answer: A. The spleen filters out infected red blood cells. Rationale: The spleen plays an important role in filtering out infected red blood cells during malaria infection. The other options B, C, D do not accurately describe the spleen's role in malaria. 31. In the life cycle of the Plasmodium parasite, which type of cells does the parasite infect initially after being transmitted by an Anopheles mosquito? A. Red blood cells. B. Liver cells. C. White blood cells. D. Platelets. Answer: B. Liver cells. Rationale: After transmission by the Anopheles mosquito, the Plasmodium sporozoites initially infect liver cells, where they mature and multiply. Red blood cells, A, white blood cells, C, and platelets, D, are involved in later stages of the parasite's life cycle. 32. Which of the following complications of malaria can result in the most significant neurologic damage and is considered a medical emergency? A. Anemia. B. Cerebral malaria. C. Hepatic failure. D. Splenomegaly. Answer: B. Cerebral malaria. Rationale: cerebral malaria is a severe complication of malaria, often caused by Plasmodium falciparum, and can lead to significant neurological damage, including coma and death. Anemia, A. Hepatic failure, C. And splenomegaly, D. can also occur but are not as immediately life-threatening as cerebral malaria. 33. What is the recommended treatment for a pregnant woman diagnosed with uncomplicated malaria caused by Plasmodium falciparum in an area with chloroquine resistance? A. Quinine and clindamycin. B. Artemisinin-based combination therapy, ACT. C. Mefloquine. D. Chloroquine. Answer: A. Quinine and clindamycin. Rationale: quinine and clindamycin are recommended for the treatment of uncomplicated malaria in pregnant women, especially in areas with chloroquine resistance. Artemisinin-based combination therapy, ACT, B, is generally not recommended during the first trimester of pregnancy. Mefloquine, C, and chloroquine, D, are not ideal in areas with resistance or during pregnancy. 34. Which of the following is a key symptom of malaria that distinguishes it from other febrile illnesses? A. Cyclical fever with chills and sweats. B. Persistent cough. C. Diarrhea. D. Nausea and vomiting. Answer: A. Cyclical fever with chills and sweats. Rationale: the hallmark of malaria is a cyclical pattern of fever with chills and sweats, often occurring every 48 or 72 hours, depending on the Plasmodium species. Persistent cough, B, diarrhea, C, and nausea and vomiting, D, are not as specific to malaria. 35. Which of the following is not a typical clinical manifestation of severe malaria? A. Hypoglycemia. B. Jaundice. C. Sepsis. D. Malaria-retinopathy. Answer: C. Sepsis. Rationale: hypoglycemia, A, jaundice, B, and malaria-retinopathy, D, are common manifestations of severe malaria, while sepsis, C, is not typically associated with malaria. 36. What is the preferred diagnostic method for detecting malaria in resource-limited settings? A. PCR test. B. Rapid diagnostic test, RDT. C. Blood culture. D. Liver biopsy. Answer: B. Rapid diagnostic test, RDT. Rationale: rapid diagnostic tests, RDTs, are quick, easy, and cost-effective methods for diagnosing malaria in resource-limited settings. PCR, A, blood cultures, C, and liver biopsy, D, are more specialized methods, less suitable for widespread use in such areas. 37. What is the major risk factor for malaria in travelers to endemic areas? A. Lack of immunization. B. Not taking malaria prophylaxis. C. Living in a high-altitude area. D. Exposure to cold temperatures. Answer: B. Not taking malaria prophylaxis. Rationale: the major risk factor for malaria in travelers is not taking malaria prophylaxis, which helps prevent infection. Lack of immunization, A, is not an issue for malaria, as no vaccine is widely available. High-altitude areas, C, and cold temperatures, D, do not significantly affect malaria transmission. 38. Which of the following medications can be used to treat the liver hypnozoite stage of Plasmodium vivax and prevent relapse? A. Primaquine. B. Mefloquine. C. Artemether. D. Quinine. Answer: A. Primaquine. Rationale: primaquine is the only drug that targets the liver hypnozoite stage of Plasmodium vivax, helping to prevent relapse. Mefloquine, B, Artemether, C, and quinine, D, do not target this stage. 39. Which of the following Plasmodium species is the most likely to cause severe, life-threatening malaria with organ failure? A. Plasmodium falciparum. B. Plasmodium malariae. C. Plasmodium vivax. D. Plasmodium ovale. Answer: A. Plasmodium falciparum. Rationale: Plasmodium falciparum is the most virulent and can cause severe, life-threatening complications such as organ failure, cerebral malaria, and death. The other species, such as Plasmodium malariae B, vivax C, and ovale D, are less likely to cause severe illness. 40. Which of the following is not an effective strategy for malaria prevention in endemic areas? A. Insecticide-treated bed nets. B. Indoor spraying with insecticides. C. Routine administration of chloroquine. D. Wearing long-sleeved clothing. Answer: C. Routine administration of chloroquine. Rationale: routine administration of chloroquine, C, is not an effective strategy for malaria prevention in endemic areas, especially due to resistance. Insecticide-treated bed nets, A, indoor spraying, B, and wearing long-sleeved clothing, D, are all effective prevention measures. 41. Which of the following is a characteristic feature of malaria caused by Plasmodium falciparum? A. Fever every 48 hours. B. Fever every 72 hours. C. Hypoglycemia. D. Splenomegaly. Answer: A. Fever every 48 hours. Rationale: Plasmodium falciparum typically causes a fever pattern every 48 hours. Plasmodium vivax and Plasmodium ovale, on the other hand, cause a fever every 72 hours. B. Hypoglycemia, C, and splenomegaly, D, are not primary characteristics of P. falciparum infection. 42. Which of the following interventions is most effective in preventing malaria transmission by mosquitoes in high-risk areas? A. Indoor spraying of insecticides. B. Using insect repellent only. C. Sleeping outdoors. D. Drinking antimalarial medications. Answer: A. Indoor spraying of insecticides. Rationale: indoor spraying of insecticides is highly effective in reducing malaria transmission by killing mosquitoes. Using insect repellent, B, and sleeping outdoors, C, are less effective, and drinking antimalarial medications, D, does not prevent mosquito bites. 43. A traveler to an endemic area of malaria has been prescribed mefloquine for malaria prophylaxis. Which of the following is a common side effect of this medication? A. Headache. B. Diarrhea. C. Insomnia. D. Dizziness. Answer: D. Dizziness. Rationale: dizziness is a common side effect of mefloquine used for malaria prophylaxis. Headache, A, diarrhea, B, and insomnia, C, are less commonly associated with mefloquine. 44. Which of the following is the primary target for antimalarial drugs such as chloroquine and artemisinin? A. Red blood cells. B. Mitochondria of the parasite. C. Liver cells. D. Anopheles mosquitoes. Answer: B. Mitochondria of the parasite. Rationale: antimalarial drugs like chloroquine and artemisinin target the mitochondria of the Plasmodium parasite, specifically inhibiting its ability to replicate. Red blood cells, A, liver cells, C, and Anopheles mosquitoes, D, are not the primary targets for these drugs. 45. Which of the following is the best way to prevent relapse of Plasmodium vivax malaria? A. Treatment with primaquine. B. Repeated chloroquine therapy. C. Use of insecticide-treated bed nets. D. Daily malaria prophylaxis with doxycycline. Answer: A. Treatment with primaquine. Rationale: treatment with primaquine is effective in eliminating the liver hypnozoites of Plasmodium vivax and preventing relapse. Repeated chloroquine therapy, B, bed nets, C, and daily prophylaxis with doxycycline, D, do not address the dormant liver stage of the parasite. 46. Which of the following statements regarding malaria transmission is true? A. Malaria can be transmitted by sexual contact. B. Malaria is transmitted by mosquitoes. C. Malaria can be transmitted through contact with infected blood. D. Malaria can be transmitted by air. Answer: B. Malaria is transmitted by mosquitoes. Rationale: malaria is transmitted by the bite of an infected Anopheles mosquito. It cannot be transmitted by sexual contact, A, air, D, or by casual contact with infected blood, C. 47. Which of the following groups of people is at greatest risk of severe complications from malaria? A. Healthy young adults. B. Pregnant women. C. People living in temperate climates. D. Children under 5 years of age. Answer: B. Pregnant women. Rationale: pregnant women are at high risk for severe complications from malaria, including maternal and fetal death. Children under 5 years of age, D, and healthy young adults, A, are also vulnerable, but pregnant women are especially at risk. 48. Which of the following is a potential complication of malaria infection caused by Plasmodium falciparum? A. Cerebral malaria. B. Mild anemia. C. Dysentery. D. Meningitis. Answer: A. Cerebral malaria. Rationale: cerebral malaria, caused by Plasmodium falciparum, is a severe and life-threatening complication. Mild anemia, B, dysentery, C, and meningitis, D, are not typical complications of malaria. 49. Which of the following factors most significantly contributes to the spread of malaria in endemic areas? A. High population density. B. Inadequate sanitation. C. Lack of mosquito control measures. D. Frequent travel between regions. Answer: C. Lack of mosquito control measures. Rationale: the lack of effective mosquito control measures, such as insecticide-treated bed nets and indoor spraying, is the primary factor in the spread of malaria. High population density, A, inadequate sanitation, B, and frequent travel, D, can contribute, but mosquito control is the key intervention. 50. What is the most common form of malaria caused by Plasmodium falciparum in endemic regions? A. Mild malaria. B. Severe malaria. C. Relapsing malaria. D. Chronic malaria. Answer: B. Severe malaria. Rationale: Plasmodium falciparum often causes severe malaria, which includes complications such as cerebral malaria and organ failure. Mild malaria, A, relapsing malaria, C, and chronic malaria, D, are not as common. 51. In which organ does the Plasmodium parasite undergo sexual reproduction after being ingested by the Anopheles mosquito? A, the liver. B, the spleen. C, the red blood cells. D, the bone marrow. Answer: A, the liver. Rationale: after ingestion by the Anopheles mosquito, the Plasmodium parasite undergoes sexual reproduction in the mosquito's gut, which occurs in the liver. The other organs listed are not involved in this process. 52. Which of the following methods is most effective in preventing malaria transmission by mosquitoes? A. Wearing brightly colored clothing. B. Using insecticide-treated bed nets. C. Avoiding outdoor activities during the day. D. Taking antipyretics regularly. Answer: B. Using insecticide-treated bed nets. Rationale: insecticide-treated bed nets are the most effective method for preventing mosquito bites during sleep, the most critical time for malaria transmission. Wearing brightly colored clothing, A. Avoiding daytime activities, C, and taking antipyretics, D, are not effective preventive strategies. 53. What is the most common method of diagnosing malaria in areas with limited healthcare resources? A. Rapid diagnostic tests, RDTs. B. Polymerase chain reaction, PCR, tests. C. Blood culture. D. Ultrasound. Answer: A. Rapid diagnostic tests, RDTs. Rationale: rapid diagnostic tests, RDTs, are widely used in resource-limited settings because they are quick, affordable, and easy to use for diagnosing malaria. PCR tests, B, blood cultures, C, and ultrasounds, D, are more specialized and not practical for widespread use in such settings. 54. Which of the following is the most common vector for malaria transmission? A. Culex mosquito. B. Aedes mosquito. C. Anopheles mosquito. D. Tsetse fly. Answer: C. Anopheles mosquito. Rationale: the Anopheles mosquito is the primary vector for malaria transmission. Culex, A, and Aedes, B, mosquitoes are vectors for other diseases, while the tsetse fly, D, is associated with sleeping sickness. 55. Which of the following Plasmodium species is most commonly associated with recurrent malaria episodes, relapse? A. Plasmodium falciparum. B. Plasmodium malariae. C. Plasmodium vivax. D. Plasmodium ovale. Answer: C. Plasmodium vivax. Rationale: Plasmodium vivax is known to cause relapsing malaria due to the dormant liver stage of the parasite, hypnozoites. Plasmodium falciparum A, malariae B, and ovale D are less likely to cause relapse. 56. Which of the following anti-malarial medications is considered the first-line treatment for uncomplicated malaria in areas without chloroquine resistance? A. Artemisinin-based combination therapy, ACT. B. Chloroquine. C. Mefloquine. D. Quinine. Answer: B. Chloroquine. Rationale: Chloroquine is the first-line treatment for uncomplicated malaria in areas without chloroquine resistance. Artemisinin-based combination therapy, ACT, A, is used in areas with resistance, while mefloquine, C, and quinine, D, are used for specific cases. 57. A patient with malaria develops confusion, seizures, and loss of consciousness. These symptoms are most consistent with which complication? A. Cerebral malaria. B. Acute renal failure. C. Splenic rupture. D. Hepatic failure. Answer: A. Cerebral malaria. Rationale: Cerebral malaria, which is most commonly caused by Plasmodium falciparum, is characterized by confusion, seizures, and loss of consciousness. Acute renal failure, B, splenic rupture, C, and hepatic failure, D, are possible complications, but they are less likely to present with these neurological symptoms. 58. Which of the following anti-malarial medications is primarily used to treat the liver stage of Plasmodium vivax and prevent relapse? A. Quinine. B. Primaquine. C. Artemisinin. D. Mefloquine. Answer: B. Primaquine. Rationale: Primaquine is used to treat the liver stage, hypnozoites, of Plasmodium vivax and prevent relapse. Quinine, A, artemisinin, C, and mefloquine, D, are not effective for treating the liver stage of the parasite. 59. What is the preferred method for diagnosing malaria in a patient presenting with symptoms in an area with confirmed malaria transmission? A. Rapid diagnostic test, RDT. B. Blood smear. C. Urine culture. D. X-ray imaging. Answer: B. Blood smear. Rationale: a blood smear is the gold standard for diagnosing malaria, as it allows for direct observation of the Plasmodium parasite in red blood cells. Rapid diagnostic tests, RDTs, A, are useful but not as accurate as a blood smear. Urine cultures, C, and X-ray imaging, D, are not used to diagnose malaria. 60. Which of the following is the most likely cause of a relapse of malaria caused by Plasmodium vivax? A. Reinfection with Plasmodium falciparum. B. Hypnozoites in the liver. C. Inadequate treatment with antimalarial drugs. D. Increased immune suppression. Answer: B. Hypnozoites in the liver. Rationale: the relapse of malaria caused by Plasmodium vivax is due to the presence of dormant hypnozoites in the liver, which can reactivate and cause a new cycle of infection. Reinfection, A, inadequate treatment, C, and immune suppression, D, may contribute to malaria in general, but they are not the primary cause of relapse in vivax malaria. 61. A patient with malaria caused by Plasmodium falciparum presents with a fever, chills, and tachycardia. These are indicative of which phase of the disease? A. Incubation phase. B. Acute febrile phase. C. Recovery phase. D. Chronic phase. Answer: B. Acute febrile phase. Rationale: the acute febrile phase of malaria is characterized by fever, chills, and other symptoms of systemic infection. The incubation phase, A, occurs before symptoms appear. The recovery phase, C, and chronic phase, D, occur later in the disease course. 62. Which of the following is the primary reason for the widespread distribution of malaria in sub-Saharan Africa? A. Lack of access to vaccines. B. High mosquito populations. C. High rates of antibiotic resistance. D. Poor sanitation. Answer: B. High mosquito populations. Rationale: Malaria is widespread in sub-Saharan Africa primarily due to the high populations of Anopheles mosquitoes, which are the vectors of the Plasmodium parasite. Lack of vaccines, A. Antibiotic resistance, C. And poor sanitation, D. are contributing factors but are not the primary cause. 63. A traveler to a malaria-endemic area has been prescribed doxycycline for malaria prophylaxis. Which of the following is a common side effect of this medication? A. Photosensitivity. B. Nausea and vomiting. C. Diarrhea. D. Hepatitis. Answer. A. Photosensitivity. Rationale. Photosensitivity is a common side effect of doxycycline, which is used for malaria prophylaxis. Nausea and vomiting, B. Diarrhea, C. And hepatitis, D. are possible side effects but are less common. 64. Which of the following Plasmodium species is responsible for the most severe form of malaria, including cerebral malaria and organ failure? A. Plasmodium falciparum. B. Plasmodium vivax. C. Plasmodium malariae. D. Plasmodium ovale. Answer. A. Plasmodium falciparum. Rationale. Plasmodium falciparum is responsible for the most severe form of malaria, which can cause cerebral malaria and organ failure. The other species, B, C, D, are associated with less severe forms of the disease. 65. What is the first-line treatment for uncomplicated malaria caused by Plasmodium falciparum in areas with chloroquine resistance? A. Artemisinin-based combination therapy, ACT. B. Quinine and doxycycline. C. Mefloquine. D. Chloroquine. Answer. A. Artemisinin-based combination therapy, ACT. Rationale. Artemisinin-based combination therapy, ACT, is the first-line treatment for uncomplicated malaria caused by Plasmodium falciparum in areas with chloroquine resistance. Quinine and doxycycline B, mefloquine C, and chloroquine D are not first-line treatments in these areas. 66. Which of the following is a key feature of severe malaria caused by Plasmodium falciparum? A. Mild anemia. B. Cerebral malaria. C. Mild fever. D. Abdominal pain. Answer. B. Cerebral malaria. Rationale. Cerebral malaria, a severe complication of Plasmodium falciparum infection, is characterized by neurological symptoms such as altered consciousness, seizures, and coma. Mild anemia, A, fever, C, and abdominal pain, D, are not distinguishing features of severe malaria. 67. Which of the following is a common complication of malaria caused by Plasmodium falciparum? A. Hypoglycemia. B. Ascites. C. Hematuria. D. Hyperkalemia. Answer. A. Hypoglycemia. Rationale. Hypoglycemia is a common complication of severe malaria, particularly in patients treated with quinine. Ascites, B, hematuria, C, and hyperkalemia, D, are not common complications of malaria. 68. Which of the following is the primary reason for malaria's high incidence in sub-Saharan Africa? A. A lack of access to antimalarial drugs. B. Widespread Anopheles mosquito populations. C. High rates of HIV/AIDS. D. Inadequate healthcare infrastructure. Answer. B. Widespread Anopheles mosquito populations. Rationale. The widespread presence of Anopheles mosquitoes, which transmit the Plasmodium parasite, is the primary reason for malaria's high incidence in sub-Saharan Africa. Lack of access to antimalarial drugs, A. High rates of HIV/AIDS, C, and inadequate healthcare infrastructure, D, are contributing factors but are not the primary causes. 69. Which of the following mosquitoes is the primary vector for malaria transmission? A. Aedes mosquito. B. Culex mosquito. C. Anopheles mosquito. D. Tsetse fly. Answer. C. Anopheles mosquito. Rationale. The Anopheles mosquito is the primary vector responsible for transmitting the Plasmodium parasite that causes malaria. Aedes, A, Culex, B, and tsetse flies, D, transmit other diseases but are not involved in malaria transmission. 70. Which of the following is the main cause of mortality in severe malaria? A. Respiratory failure. B. Hepatic failure. C. Cerebral malaria. D. Renal failure. Answer: C. Cerebral malaria. Rationale: cerebral malaria, often caused by Plasmodium falciparum, is a leading cause of mortality in severe malaria due to neurological involvement, including coma and seizures. Respiratory failure, A, hepatic failure, B, and renal failure, D, are less common causes of death compared to cerebral malaria. 71. A traveler to a malaria-endemic area has been prescribed chloroquine for malaria prophylaxis. Which of the following side effects is commonly associated with this medication? A. Retinal toxicity. B. Photosensitivity. C. Diarrhea. D. Headache. Answer: A. Retinal toxicity. Rationale: chloroquine is associated with retinal toxicity, especially with long-term use. Photosensitivity, B, diarrhea, C, and headache, D, are more commonly seen with other drugs, such as doxycycline. 72. Which of the following is a key feature of the pathophysiology of malaria caused by Plasmodium falciparum? A. Infection of liver cells. B. Erythrocyte destruction. C. Production of antigens. D. Formation of cysts. Answer: B. Erythrocyte destruction. Rationale: in Plasmodium falciparum malaria, the parasite infects red blood cells, causing their destruction and leading to symptoms such as anemia, fever, and fatigue. Liver cell infection, A, antigen production, C, and cyst formation, D, are not characteristic features of falciparum malaria. 73. What is the primary reason for the global resurgence of malaria despite previous efforts at control and eradication? A. Increased resistance to anti-malarial drugs. B. Climate change leading to increased mosquito populations. C. Increased global travel. D. Reduced funding for malaria control programs. Answer: A. Increased resistance to anti-malarial drugs. Rationale: the global resurgence of malaria is primarily due to the development of resistance to commonly used anti-malarial drugs, such as chloroquine and artemisinin. Climate change, B, increased global travel, C, and reduced funding, D, are also contributing factors but are not the primary reasons for the resurgence. 74. Which of the following is a key risk factor for severe malaria in children under 5 years of age? A. Immunity from previous infections. B. Presence of comorbid conditions, such as malnutrition. C. High body temperature. D. Gender. Answer: B. Presence of comorbid conditions, such as malnutrition. Rationale: children under 5 years of age are at high risk for severe malaria, especially if they have comorbid conditions like malnutrition, which weakens the immune system. Immunity, A, high body temperature, C, and gender, D, do not significantly influence the severity of malaria in children. 75. Which of the following is the most effective way to prevent malaria in travelers to endemic areas? A. Taking malaria prophylaxis. B. Using insect repellent only. C. Sleeping outdoors. D. Eating anti-malarial foods. Answer: A. Taking malaria prophylaxis. Rationale: the most effective way to prevent malaria in travelers is through malaria prophylaxis, which reduces the risk of infection. Insect repellent, B, is also important, but it is not as effective on its own. Sleeping outdoors, C, and eating anti-malarial foods, D, are not proven prevention strategies. 76. Which of the following is a clinical manifestation of severe malaria that warrants urgent medical intervention? A. Mild fever. B. Splenomegaly. C. Jaundice and anemia. D. Nausea and vomiting. Answer: C. Jaundice and anemia. Rationale: jaundice and anemia are common clinical manifestations of severe malaria, which requires urgent medical intervention to prevent complications like organ failure. Mild fever, A, splenomegaly, B, and nausea and vomiting, D, are more common in uncomplicated malaria. 77. Which of the following is a common complication of malaria caused by Plasmodium falciparum? A. Jaundice. B. Cerebral malaria. C. Hepatitis. D. Anemia. Answer: B. Cerebral malaria. Rationale: cerebral malaria is a common and serious complication of malaria caused by Plasmodium falciparum, potentially leading to neurological damage. Jaundice, A, hepatitis C, and anemia, D, can occur in malaria but are not the most specific complications of falciparum malaria. 78. Which of the following medications is used to treat the blood stages of malaria caused by Plasmodium vivax? A. Primaquine. B. Chloroquine. C. Mefloquine. D. Artemisinin. Answer: B. Chloroquine. Rationale: chloroquine is the medication of choice to treat the blood stages of Plasmodium vivax. Primaquine, A, is used for the liver stage, while mefloquine, C, and artemisinin, D, are alternatives for other species. 79. Which of the following is the most common form of malaria found in sub-Saharan Africa? A. Plasmodium vivax. B. Plasmodium malariae. C. Plasmodium ovale. D. Plasmodium falciparum. Answer: D. Plasmodium falciparum. Rationale: Plasmodium falciparum is the most common and most dangerous form of malaria in sub-Saharan Africa. Plasmodium vivax, A, malariae, B, and ovale, C, are less common in this region. 80. Which of the following is a potential side effect of long-term use of primaquine for malaria treatment? A. Retinal damage. B. Liver toxicity. C. Hemolytic anemia in G6PD deficient individuals. D. Cardiac arrhythmias. Answer: C. Hemolytic anemia in G6PD deficient individuals. Rationale: primaquine can cause hemolytic anemia in individuals with G6PD deficiency. Retinal damage, A, liver toxicity, B, and cardiac arrhythmias, D, are not common side effects of primaquine. 81. Which of the following is a characteristic finding on a blood smear in a patient with malaria caused by Plasmodium falciparum? A. Ring-shaped trophozoites inside red blood cells. B. Schaffner's dots in red blood cells. C. Multiple merozoites inside a schizont. D. Crescent-shaped gametocytes. Answer: A. Ring-shaped trophozoites inside red blood cells. Rationale: the characteristic finding in Plasmodium falciparum malaria is the presence of ring-shaped trophozoites inside red blood cells. Schaffner's dots, B, are found in Plasmodium vivax, and multiple merozoites, C, and crescent-shaped gametocytes, D, are associated with other stages or species of malaria. 82. What is the main mechanism of action of artemisinin-based combination therapies, ACTs, used in malaria treatment? A. They inhibit the synthesis of hemoglobin. B. They interfere with the parasite's cell membrane. C. They cause oxidative stress to the parasite. D. They block folate metabolism. Answer: C. They cause oxidative stress to the parasite. Rationale: artemisinin-based combination therapies, ACTs, work by inducing oxidative stress within the parasite, leading to its destruction. The other mechanisms listed are not the primary action of ACTs. 83. What is the primary method of transmission for malaria? A. Fecal-oral route. B. Vector-borne transmission via mosquito bite. C. Airborne transmission. D. Person-to-person contact. Answer: B. Vector-borne transmission via mosquito bite. Rationale: malaria is transmitted primarily through the bite of an infected Anopheles mosquito, vector-borne transmission. Fecal-oral, A, airborne, C, and person-to-person, D, transmission are not routes for malaria transmission. 84. In what stage of the malaria parasite's life cycle does it enter the human bloodstream to infect red blood cells? A. Sporozoite. B. Merozoite. C. Gametocyte. D. Hypnozoite. Answer: A. Sporozoite. Rationale: the sporozoite stage of the malaria parasite enters the human bloodstream after being injected by an infected mosquito. Merozoites, B, gametocytes, C, and hypnozoites, D, are other stages, but they do not directly enter the bloodstream to infect red blood cells. 85. What is the most common diagnostic test for malaria in a clinical setting? A. Blood smear. B. Urine test. C. CT scan. D. Electrocardiogram. Answer: A. Blood smear. Rationale: the blood smear is the most common and reliable diagnostic test for malaria, allowing for direct observation of the Plasmodium parasite in red blood cells. Urine tests, B. CT scans, C. and ECGs D are not used to diagnose malaria. 86. Which of the following is an important preventive measure for pregnant women traveling to malaria-endemic areas? A. Using insecticide-treated bed nets. B. Taking doxycycline. C. Taking chloroquine alone. D. Using indoor fogging. Answer: A. Using insecticide-treated bed nets. Rationale: pregnant women are at increased risk of malaria-related complications, and using insecticide-treated bed nets is an important preventive measure. Doxycycline B is not recommended for pregnant women, and chloroquine alone, C, and indoor fogging, D, are not primary preventive strategies. 87. Which of the following factors contributes most to the difficulty of malaria eradication in many countries? A. Widespread use of antibiotics. B. Resistance to insecticides and antimalarial drugs. C. High vaccination rates. D. Lack of funding for healthcare. Answer: B. Resistance to insecticides and antimalarial drugs. Rationale: the development of resistance to both insecticides and antimalarial drugs has made malaria eradication challenging. Widespread use of antibiotics, A. High vaccination rates, C. And lack of funding, D. may contribute but are not the primary factors. 88. What is the purpose of using a combination of antimalarial drugs in the treatment of malaria? A. To increase the effectiveness of treatment. B. To prevent drug resistance. C. To reduce side effects. D. To treat multiple infections simultaneously. Answer: B. To prevent drug resistance. Rationale: combining antimalarial drugs helps prevent the development of drug resistance by attacking the parasite at different stages of its life cycle. Although it can increase effectiveness, A. Reduce side effects, C. And treat multiple infections, D. The primary goal is to prevent resistance. 89. What is the primary reason that malaria prevention strategies are not 100% effective? A. Incomplete adherence to prevention measures. B. Lack of awareness among the population. C. Inadequate treatment of infected individuals. D. Resistance to prevention methods. Answer: A. Incomplete adherence to prevention measures. Rationale: incomplete adherence to prevention measures, such as inconsistent use of bed nets and failure to take prophylactic medication, is the main reason malaria prevention strategies are not fully effective. Lack of awareness, B. Inadequate treatment, C. And resistance, D. are also factors, but not the primary reason. 90. Which mosquito is the primary vector for malaria transmission? A. Anopheles mosquito. B. Culex mosquito. C. Aedes mosquito. D. Tsetse fly. Answer: A. Anopheles mosquito. Rationale: the Anopheles mosquito is the primary vector responsible for transmitting the Plasmodium parasite that causes malaria. Culex, B. Aedes, C. and Tsetse fly, D. are vectors for other diseases, but are not involved in malaria transmission. 91. Which of the following is most commonly associated with severe malaria caused by Plasmodium falciparum? A. Severe anemia. B. Jaundice. C. Hemolytic anemia. D. Cerebral malaria. Answer: D. Cerebral malaria. Rationale: cerebral malaria, often associated with Plasmodium falciparum, involves altered consciousness, seizures, and coma. Severe anemia, A. Jaundice, B. and hemolytic anemia, C. are possible but less commonly associated with severe malaria. 92. Which of the following diagnostic tools is most commonly used to confirm malaria infection? A. PCR, polymerase chain reaction. B. Rapid diagnostic tests, RDT. C. Blood smear. D. Urine analysis. Answer: C. Blood smear. Rationale: a blood smear is the most commonly used method for diagnosing malaria by allowing identification of the Plasmodium parasite. PCR, A, and RDT, B, are also used in some settings, but the blood smear remains the gold standard for diagnosis. Urine analysis, D, is not used for diagnosing malaria. 93. What is the primary treatment for malaria caused by Plasmodium falciparum in areas with chloroquine resistance? A. Artemisinin-based combination therapy, ACT. B. Chloroquine alone. C. Quinine and doxycycline. D. Mefloquine. Answer: A. Artemisinin-based combination therapy, ACT. Rationale: ACT is the primary treatment for Plasmodium falciparum malaria in areas with chloroquine resistance. Chloroquine, B, and mefloquine, D, are no longer effective in such areas, and quinine with doxycycline, C, is a second-line treatment. 94. Which of the following groups is most at risk of developing severe malaria? A. Children under 5 years of age. B. Elderly individuals over 65. C. Non-pregnant adults. D. Immunocompetent individuals. Answer: A. Children under 5 years of age. Rationale: children under 5 years are particularly vulnerable to severe malaria due to an immature immune system. Elderly individuals, B, and non-pregnant adults, C, are also at risk, but not to the same extent as young children. Immunocompetent individuals, D, generally have a lower risk of severe malaria. 95. Which of the following is the most common symptom of malaria? A. Severe headache. B. Fever. C. Jaundice. D. Cough. Answer: B. Fever. Rationale: fever is the most common symptom of malaria due to the cyclical nature of the parasite's life cycle. Severe headache, A, jaundice, C, and cough, D, may occur but are not as commonly associated with malaria. 96. Which of the following measures is the most effective in preventing malaria transmission in endemic areas? A. Use of insecticide-treated bed nets. B. Indoor spraying of insecticides. C. Taking prophylactic antimalarial drugs. D. Avoiding outdoor activities at night. Answer: A. Use of insecticide-treated bed nets. Rationale: the most effective prevention strategy for malaria is the use of insecticide-treated bed nets, which protect individuals from mosquito bites during the night when Anopheles mosquitoes are most active. Indoor spraying, B, and prophylactic drugs, C, are also important but not as effective alone. Avoiding outdoor activities, D, is not a practical solution. 97. Which of the following is a potential side effect of using quinine to treat malaria? A. Retinal toxicity. B. Cardiac arrhythmias. C. Hyperkalemia. D. Hypertension. Answer: B. Cardiac arrhythmias. Rationale: quinine can cause cardiac arrhythmias, especially in high doses or prolonged use. Retinal toxicity, A, is more associated with chloroquine, and hyperkalemia, C, and hypertension, D, are not common side effects of quinine. 98. In what organ does the malaria parasite primarily reproduce during the liver stage of its life cycle? A. Kidney. B. Liver. C. Spleen. D. Bone marrow. Answer: B. Liver. Rationale: during the liver stage of its life cycle, the malaria parasite primarily reproduces in liver cells. The kidney, A, spleen, C, and bone marrow, D, are involved in other parts of the immune response or pathology, but not in the liver stage of the parasite's development. 99. What is the primary cause of resistance to antimalarial drugs such as chloroquine and artemisinin? A. Overuse and misuse of the drugs. B. Genetic mutation of the Plasmodium parasite. C. Inadequate treatment of malaria cases. D. Poor patient adherence to treatment. Answer: B. Genetic mutation of the Plasmodium parasite. Rationale: resistance to antimalarial drugs is primarily due to genetic mutations within the Plasmodium parasite that allow it to survive treatment. Overuse and misuse of drugs, A, and poor patient adherence, D, contribute to resistance but are secondary factors. Inadequate treatment, C, may also play a role in resistance development. 100. Which of the following is the most common cause of malaria-associated death? A. Hypoglycemia. B. Cerebral malaria. C. Liver failure. D. Renal failure. Answer: B. Cerebral malaria. Rationale: cerebral malaria is the leading cause of death in severe malaria, particularly with Plasmodium falciparum infections. Hypoglycemia, A, liver failure, C, and renal failure, D, are serious complications but are less common causes of death in malaria cases. 101. Which of the following is a hallmark of Plasmodium vivax malaria? A. Relapsing infections due to hypnozoites. B. Severe anemia. C. Cerebral malaria. D. No relapse after treatment. Answer: A. Relapsing infections due to hypnozoites. Rationale: Plasmodium vivax has the ability to form hypnozoites in the liver, leading to relapsing infections after initial treatment. Severe anemia, B, and cerebral malaria, C, are more associated with Plasmodium falciparum. Plasmodium vivax does relapse after treatment, unlike some other species, D. 102. Which of the following treatments is commonly used to treat malaria caused by Plasmodium vivax? A. Chloroquine and primaquine. B. Artemisinin-based combination therapy. C. Mefloquine and doxycycline. D. Quinine and artesunate. Answer: A. Chloroquine and primaquine. Rationale: Plasmodium vivax malaria is typically treated with chloroquine for the blood stage and primaquine to eliminate hypnozoites in the liver. Artemisinin-based combination therapy, B, is used for Plasmodium falciparum. Mefloquine, C, and quinine, D, are alternatives for other species, but not first-line treatments for vivax malaria. 103. Which of the following statements about malaria diagnosis is true? A. A positive rapid diagnostic test, RDT, is sufficient for confirming malaria. B. A blood smear is the gold standard for diagnosing malaria. C. PCR is the most commonly used diagnostic method for malaria. D. Malaria can be diagnosed using only clinical symptoms. Answer: B. A blood smear is the gold standard for diagnosing malaria. Rationale: the blood smear is considered the gold standard for diagnosing malaria by directly observing the Plasmodium parasite in red blood cells. RDTs, A, are useful for quick screening but may not be conclusive, and PCR, C, is not as commonly used. Clinical symptoms alone, D, are not sufficient for diagnosis. 104. Which of the following is a major reason why malaria remains a significant public health issue in many parts of the world? A. Inadequate mosquito control programs. B. Lack of access to anti-malarial drugs. C. High rates of antibiotic resistance. D. Poor sanitation and water access. Answer: A. Inadequate mosquito control programs. Rationale: inadequate mosquito control programs, such as insufficient use of insecticide-treated bed nets, are a primary reason why malaria remains a major public health issue. Lack of access to anti-malarial drugs, B, and high rates of antibiotic resistance, C, may contribute, but mosquito control is more central to malaria prevention. Poor sanitation and water access, D, affect other diseases, but are not the primary contributors to malaria transmission. 105. In malaria-endemic areas, which of the following strategies is essential for preventing malaria in pregnant women? A. Preventive treatment with sulfadoxine pyrimethamine. B. Bed rest during pregnancy. C. Taking antibiotics regularly. D. High-dose vitamin supplementation. Answer: A. Preventive treatment with sulfadoxine pyrimethamine. Rationale: preventive treatment with sulfadoxine pyrimethamine is commonly used to prevent malaria in pregnant women in endemic areas. Bed rest, B. Antibiotics, C. And high-dose vitamin supplementation, D, are not proven strategies for malaria prevention. 106. Which of the following is the primary mode of transmission of malaria? A. Airborne transmission. B. Fecal-oral transmission. C. Vector-borne transmission. D. Direct person-to-person contact. Answer: C. Vector-borne transmission. Rationale: malaria is primarily transmitted through the bite of an infected Anopheles mosquito. Airborne transmission, A. Fecal-oral transmission, B. And person-to-person contact, D, do not play a role in malaria transmission. 107. What is the first step in the life cycle of the Plasmodium parasite inside the human host? A. Merozoite invasion of red blood cells. B. Release of sporozoites into the bloodstream. C. Hypnozoite formation in the liver. D. Release of merozoites from the liver. Answer: B. Release of sporozoites into the bloodstream. Rationale: after the Anopheles mosquito injects sporozoites into the human bloodstream, they travel to the liver, where they mature. Merozoite invasion, A. Hypnozoite formation, C. and release from the liver, D, happen later in the cycle. 108. Which of the following antimalarial medications is used for the liver stage of Plasmodium vivax infection? A. Artemisinin. B. Chloroquine. C. Primaquine. D. Quinine. Answer: C. Primaquine. Rationale: Primaquine is used to treat the liver stage of Plasmodium vivax, eliminating dormant hypnozoites that can cause relapse. Artemisinin A, chloroquine B, and quinine D do not target the liver stage. 109. What is the function of the spleen during malaria infection? A. It filters out infected red blood cells. B. It produces antibodies to fight malaria. C. It releases sporozoites into the bloodstream. D. It produces hemoglobin to replace lost red blood cells. Answer: A. It filters out infected red blood cells. Rationale: the spleen plays a crucial role in filtering out infected red blood cells, which are destroyed by the immune system. It does not release sporozoites, C, or produce hemoglobin, D, and although it helps an immune response, B, its primary function in malaria is filtering infected red blood cells. 110. Which of the following complications is most commonly associated with Plasmodium falciparum malaria? A. Jaundice. B. Cerebral malaria. C. Splenomegaly. D. Anemia. Answer: B. Cerebral malaria. Rationale: cerebral malaria, which can cause coma and neurological damage, is most commonly associated with Plasmodium falciparum infection. Jaundice A, splenomegaly C, and anemia D may occur but are not as specific or as life-threatening as cerebral malaria. 111. What is the primary treatment for uncomplicated malaria caused by Plasmodium falciparum in areas with no drug resistance? A. Artemisinin-based combination therapy, ACT. B. Chloroquine. C. Quinine and doxycycline. D. Mefloquine. Answer: B. Chloroquine. Rationale: chloroquine is the treatment of choice for uncomplicated malaria caused by Plasmodium falciparum in areas without drug resistance. ACT A is used in areas with resistance, while quinine and doxycycline C are second-line therapies. Mefloquine D is used in some cases, but is not first-line treatment for uncomplicated falciparum malaria. 112. Which of the following groups is most at risk for developing severe malaria? A. Pregnant women. B. Adults with no previous malaria exposure. C. Children over 10 years old. D. Non-immunocompromised individuals. Answer: A. Pregnant women. Rationale: pregnant women are at higher risk for severe malaria due to altered immune function and changes in the placenta. Adults with prior exposure, B. Children over 10 years, C. And non-immunocompromised individuals, D. are less likely to experience severe malaria. 113. What is the most commonly used method for malaria prevention in endemic areas? A. Vaccine administration. B. Insecticide-treated bed nets. C. Oral antimalarial prophylaxis. D. Indoor spraying of insecticides. Answer: B. Insecticide-treated bed nets. Rationale: insecticide-treated bed nets are the most commonly used and effective method for malaria prevention, particularly in endemic areas. Vaccines A are still under development, oral prophylaxis C and indoor spraying D are complementary but less common methods. 114. Which of the following is a primary reason for the development of antimalarial drug resistance? A. Overuse and misuse of drugs. B. Malaria parasite mutation. C. Lack of access to healthcare. D. Poor hygiene. Answer: A. Overuse and misuse of drugs. Rationale: overuse and misuse of antimalarial drugs contribute to the development of drug resistance by selecting for resistant parasites. Mutation of the parasite, B, and poor healthcare access, C, also play a role, but drug misuse, A, is the most significant factor. Poor hygiene, D, is not directly related to drug resistance. 115. What is the hallmark of a blood smear in a patient infected with Plasmodium falciparum? A. Ring-shaped trophozoites in red blood cells. B. Schuffner's dots in red blood cells. C. Crescent-shaped gametocytes. D. Merozoites inside a schizoid. Answer: A. ring-shaped trophozoites in red blood cells. Rationale: in Plasmodium falciparum malaria, ring-shaped trophozoites inside red blood cells are a hallmark of infection. Schaffner's dots, B, are found in Plasmodium vivax, and crescent-shaped gametocytes, C, are associated with later stages of falciparum infection. Merozoites inside a schizoid, D, are not specific to falciparum malaria. 116. Which of the following symptoms is most commonly associated with malaria during the initial phase of infection? A. Fever and chills. B. Severe headache.
C. Jaundice.
D. Muscle pain. Answer: A. Fever and chills. Rationale: fever and chills are the hallmark symptoms of the initial phase of malaria infection, caused by the release of merozoites from infected red blood cells. Severe headache, B, jaundice, C, and muscle pain, D, can occur later in the disease, but are less common at the onset. 117. What is the most effective way to prevent malaria in travelers to endemic areas? A. Using insect repellents. B. Taking anti-malarial drugs. C. Using insecticide-treated bed nets. D. All of the above. Answer: D. All of the above. Rationale: a combination of insect repellents, anti-malarial drugs, and insecticide-treated bed nets provides the most effective prevention strategy for travelers to malaria-endemic areas. Each method works synergistically to reduce the risk of infection. 118. What is the key feature of severe malaria that differentiates it from uncomplicated malaria? A. High fever and chills. B. Organ failure and cerebral malaria. C. Mild anemia. D. Presence of jaundice. Answer: B. Organ failure and cerebral malaria. Rationale: severe malaria is characterized by complications such as organ failure and cerebral malaria, which can lead to death. High fever and chills, A. Mild anemia, C. And jaundice, D. can also be present but are not specific to severe malaria. 119. Which of the following populations is most susceptible to malaria infection? A. Elderly individuals with compromised immunity. B. Children under the age of 5. C. Pregnant women in malaria-endemic areas. D. All of the above. Answer: D. All of the above. Rationale: children under 5, pregnant women, and elderly individuals with compromised immunity are all at high risk for malaria infection and severe complications due to their vulnerable immune systems. 120. Which of the following is a recommended strategy for the prevention of malaria in pregnant women? A. Taking doxycycline during pregnancy. B. Use of insecticide-treated bed nets. C. Oral antimalarial prophylaxis. D. Using oral contraceptives to avoid pregnancy. Answer: B. Use of insecticide-treated bed nets. Rationale: the use of insecticide-treated bed nets is the most effective and recommended strategy for preventing malaria in pregnant women. Doxycycline, A, is contraindicated. 121. Which of the following is the most common complication associated with severe malaria? A. Hypoglycemia. B. Cerebral malaria. C. Acute kidney injury. D. Severe anemia. Answer: B. Cerebral malaria. Rationale: cerebral malaria, caused by Plasmodium falciparum, is the most common and severe complication, characterized by altered mental status and neurological deficits. Hypoglycemia, A, acute kidney injury, C, and anemia, D, are also complications but less common. 122. Which of the following is a potential side effect of the drug chloroquine when used to treat malaria? A. Diarrhea. B. Retinal toxicity. C. Hypertension. D. Liver failure. Answer: B. Retinal toxicity. Rationale: retinal toxicity is a known side effect of chloroquine, especially with prolonged use or high doses. Diarrhea, A, hypertension, C, and liver failure, D, are not typical side effects of chloroquine. 123. What is the primary mechanism of action of artemisinin-based combination therapies, ACTs, in treating malaria? A. Interferes with DNA synthesis. B. Inhibits protein synthesis. C. Targets the parasite's mitochondria. D. Generates free radicals that destroy the parasite. Answer: D. Generates free radicals that destroy the parasite. Rationale: artemisinin generates free radicals that disrupt the malaria parasite's internal structures, leading to its death. It does not primarily affect DNA, A, protein synthesis, B, or mitochondria, C. 124. In what way does malaria cause anemia in infected individuals? A. Hemolysis of infected red blood cells. B. Destruction of bone marrow. C. Excessive white blood cell production. D. Impaired erythropoiesis in the kidneys. Answer: A. Hemolysis of infected red blood cells. Rationale: malaria causes anemia primarily by the destruction, hemolysis, of infected red blood cells, which is a direct result of the parasite's life cycle. Destruction of bone marrow, B. Excessive white blood cell production, C. And impaired erythropoiesis, D. do not account for the primary mechanism of anemia in malaria. 125. Which of the following is the most effective way to reduce malaria transmission in endemic areas? A. Treating infected individuals with antibiotics. B. Using insecticide-treated bed nets. C. Drinking malaria-preventing water. D. Avoiding travel to endemic areas. Answer: B. Using insecticide-treated bed nets. Rationale: insecticide-treated bed nets provide the most effective prevention by preventing mosquito bites during sleep, the primary method of transmission. Antibiotics, A, are not effective in preventing transmission, and drinking water, C, and avoiding travel, D, are not practical solutions. 126. Which of the following laboratory tests is used to identify the Plasmodium parasite in blood? A. Complete blood count, CBC. B. Blood smear. C. Urinalysis. D. Chest X-ray. Answer: B. Blood smear. Rationale: a blood smear is the most common test used to identify the Plasmodium parasite by directly observing it under a microscope. CBC, A, urinalysis, C, and chest X-ray, D, are not used to diagnose malaria. 127. Which of the following is a major risk factor for malaria in pregnant women? A. Increased exposure to mosquitoes. B. Decreased immunity due to pregnancy. C. Increased blood volume during pregnancy. D. Use of insect repellents. Answer: B. Decreased immunity due to pregnancy. Rationale: pregnant women have a reduced immune response, making them more susceptible to malaria infection and its complications. Increased exposure to mosquitoes, A, and increased blood volume, C, are not major risks. Insect repellents, D, can help reduce exposure, but do not increase the risk. 128. What is the hallmark symptom of malaria that differentiates it from other febrile illnesses? A. High fever and chills in cyclical patterns. B. Persistent headache. C. Progressive weakness and fatigue. D. Cough and sore throat. Answer: A. High fever and chills in cyclical patterns. Rationale: malaria typically presents with fever and chills that occur in a cyclical pattern due to the release of merozoites from red blood cells. Other symptoms like headache, B, weakness, C, and cough, D, may occur but are not hallmark features of malaria. 129. Which of the following populations is at the highest risk for developing malaria? A. Non-immunocompromised individuals. B. Children under 5 years of age. C. Elderly individuals. D. Pregnant women in malaria-endemic areas. Answer: B. Children under 5 years of age. Rationale: children under 5 years of age are most vulnerable to severe malaria due to their immature immune systems. Pregnant women, D. Elderly individuals, C. And non-immunocompromised individuals, A. are at risk, but young children are at highest risk. 130. Which of the following drugs is typically used to treat uncomplicated malaria caused by Plasmodium vivax? A. Mefloquine. B. Artemisinin-based combination therapy.
C. Primaquine.
D. Chloroquine. Answer: D. Chloroquine. Rationale: chloroquine is commonly used to treat uncomplicated Plasmodium vivax malaria. Primaquine, C, is used to treat the liver stage, and mefloquine, A, and ACT, B, are more often used for Plasmodium falciparum. 131. What is the role of the spleen in malaria infection? A. producing antibodies against the parasite. B. Destroying infected red blood cells. C. Providing a site for parasite maturation. D. Producing red blood cells. Answer: B. Destroying infected red blood cells. Rationale: the spleen filters out and destroys infected red blood cells, which is essential for controlling the malaria infection. It does not produce red blood cells, D, or antibodies, A, and it does not provide a site for parasite maturation, C. 132. Which of the following is a characteristic of the malaria-causing Plasmodium falciparum? A. It causes relapsing infections. B. It can lead to severe complications like cerebral malaria. C. It produces hypnozoites. D. It primarily infects reticulocytes. Answer: B. It can lead to severe complications like cerebral malaria. Rationale: Plasmodium falciparum is the most virulent species, capable of causing severe complications like cerebral malaria. It does not cause relapsing infections, A, produce hypnozoites, C, or primarily infect reticulocytes, D, which are characteristics of Plasmodium vivax. 133. What is the primary action of primaquine in treating malaria caused by Plasmodium vivax? A. Treats the blood stage of the parasite. B. Eradicates hypnozoites in the liver. C. Kills merozoites in the red blood cells. D. Prevents mosquito transmission. Answer: B. Eradicates hypnozoites in the liver. Rationale: primaquine is effective against hypnozoites in the liver, preventing relapses in Plasmodium vivax infections. It does not treat the blood stage, A, kill merozoites, C, or prevent mosquito transmission, D. 134. Which of the following is a major barrier to malaria eradication efforts? A. Lack of awareness in the general population. B. Resistance to antimalarial drugs. C. Inadequate funding for health programs. D. Difficulty in developing vaccines. Answer: B. Resistance to antimalarial drugs. Rationale: resistance to both insecticides and antimalarial drugs is a major barrier to malaria eradication. While awareness, A, funding, C, and vaccine development, D, are important, drug resistance is a key challenge. 135. Which of the following best describes the role of the Anopheles mosquito in the malaria life cycle? A. It is the intermediate host where the parasite matures. B. It carries the parasite to humans during feeding. C. It reproduces the parasite inside its body. D. It spreads the parasite through fecal contamination. Answer: B. It carries the parasite to humans during feeding. Rationale: the Anopheles mosquito serves as the vector, transmitting the Plasmodium parasite to humans during its blood meal. It is not an intermediate host, A, does not reproduce the parasite, C, and does not spread the parasite via feces, D. 136. What is the main strategy for malaria prevention in travelers visiting endemic regions? A. Vaccination. B. Wearing long-sleeved clothing. C. Taking antimalarial prophylaxis. D. Avoiding eating local food. Answer: C. Taking antimalarial prophylaxis. Rationale: taking antimalarial prophylaxis is the most effective way to prevent malaria in travelers to endemic areas. Vaccination, A, is not widely available, and while wearing long sleeves, B, can help, it is not as effective as prophylaxis, C. Avoiding local food, D, does not prevent malaria. 137. What is the primary function of rapid diagnostic tests, RDTs, for malaria? A. Detect Plasmodium species in blood. B. Confirm resistance to antimalarial drugs. C. Measure the level of parasitemia. D. Detect malaria antibodies. Answer: A. Detect Plasmodium species in blood. Rationale: rapid diagnostic tests, RDTs, are used to detect the presence of Plasmodium antigens in the blood, helping diagnose malaria quickly. They do not confirm drug resistance, B, measure parasitemia, C, or detect antibodies, D. 138. Which of the following antimalarial drugs is most commonly associated with gastrointestinal side effects like nausea and vomiting? A. Quinine. B. Mefloquine. C. Artemether-lumefantrine. D. Doxycycline. Answer: D. Doxycycline. Rationale: Doxycycline is commonly associated with gastrointestinal side effects, including nausea and vomiting. Quinine, A, mefloquine, B, and artemether-lumefantrine, C, are not as likely to cause these side effects. 139. What is the key feature that distinguishes Plasmodium vivax from other Plasmodium species in terms of its treatment? A. It causes more severe symptoms. B. It can remain dormant in the liver. C. It is resistant to chloroquine. D. It only infects children. Answer. B. It can remain dormant in the liver. Rationale. Plasmodium vivax can form hypnozoites in the liver, which can remain dormant and cause relapses. It does not cause more severe symptoms. A. Is not universally resistant to chloroquine. C. And affects both adults and children. D. 140. Which of the following is the recommended approach to malaria treatment in pregnant women? A. Use of quinine and doxycycline. B. Use of artemisinin-based combination therapy, ACT. C. Use of chloroquine alone. D. Use of mefloquine with artemether. Answer. C. Use of chloroquine alone. Rationale. Chloroquine is the recommended treatment for uncomplicated malaria in pregnancy, as it is considered safe. Other options like ACT, B, or quinine with doxycycline, A, are not recommended during pregnancy. Mefloquine, D, may also not be recommended in the first trimester. 141. Which of the following is the most common early symptom of malaria? A. Nausea and vomiting. B. Insomnia and dizziness. C. Fever and chills. D. Abdominal pain and diarrhea. Answer. C. Fever and chills. Rationale. Fever and chills are the most common early symptoms of malaria, occurring due to the cyclical release of merozoites from red blood cells. Nausea, A, insomnia, B, and abdominal pain, D, are less specific and are not the hallmark of malaria. 142. What is the typical incubation period for malaria after being bitten by an infected Anopheles mosquito? A. 1 to 2 days. B. 7 to 14 days. C. 30 days. D. 3 to 4 weeks. Answer. B. 7 to 14 days. Rationale. The typical incubation period for malaria ranges from 7 to 14 days, depending on the species of Plasmodium. It is not as short as 1 to 2 days, A, or as long as 30 days, C, or 3 to 4 weeks, D. 143. Which of the following measures is most effective for preventing malaria transmission in areas with high mosquito populations? A. Widespread vaccination programs. B. Use of insecticide-treated bed nets. C. Spraying indoor insecticides only. D. Taking prophylactic anti-malarial medications. Answer. B. Use of insecticide-treated bed nets. Rationale. Insecticide-treated bed nets are one of the most effective methods for preventing malaria transmission in high-risk areas. Vaccination programs, A, are not yet widely available. Spraying insecticides, C, helps but is less effective, and prophylactic medications, D, are useful but not as comprehensive. 144. In which stage of the Plasmodium parasite's life cycle do merozoites enter red blood cells? A. Sporozoite stage. B. Merozoite stage. C. Trophozoite stage. D. Schizont stage. Answer. B. Merozoite stage. Rationale. Merozoites are the form of the parasite that infect red blood cells after they are released from schizonts. The sporozoite stage, A, is the form that enters the liver, and trophozoites, C, are the growing forms inside the red blood cells. Schizonts, D, are the stage before merozoite release. 145. Which of the following antimalarial drugs is commonly used for malaria prevention in travelers to endemic areas? A. Primaquine. B. Artemisinin-based combination therapy. C. Mefloquine. D. Chloroquine. Answer. C. Mefloquine. Rationale. Mefloquine is commonly used for malaria prevention in travelers to endemic areas, especially in regions with chloroquine resistance. Primaquine, A, is used to treat the liver stage of Plasmodium vivax, while artemisinin-based combination therapy, B, and chloroquine, D, are used for treatment, not prevention. 146. Which of the following clinical signs would suggest the development of severe malaria in a patient with Plasmodium falciparum infection? A. A mild fever and fatigue. B. Jaundice and mild anemia. C. Seizures and altered mental status. D. Mild chills and body aches. Answer: C. Seizures and altered mental status. Rationale: seizures and altered mental status are signs of cerebral malaria, a severe form of Plasmodium falciparum infection. Mild fever and fatigue, A. Jaundice, B. And chills, D. Can occur in uncomplicated malaria but are not indicative of severe malaria. 147. In a malaria-endemic area, which of the following is the most appropriate method for diagnosing malaria in a pregnant woman? A. Rapid diagnostic test, RDT. B. Bone marrow biopsy. C. Chest X-ray. D. Urine culture. Answer: A. Rapid diagnostic test, RDT. Rationale: a rapid diagnostic test, RDT, is a fast and effective way to diagnose malaria in pregnant women. Bone marrow biopsy, B. Chest X-ray, C. And urine culture, D. Are not used for diagnosing malaria. 148. What is the primary benefit of using insecticide-treated bed nets, IDNs, in malaria prevention? A. They prevent mosquito bites during sleep.
B. They kill mosquitoes on contact.
C. They eliminate hypnozoites in the liver. D. They treat existing malaria infections. Answer: A. They prevent mosquito bites during sleep. Rationale: the primary benefit of insecticide-treated bed nets, IDNs, is that they prevent mosquito bites during sleep, reducing the risk of malaria transmission. They do not kill mosquitoes on contact, B. Eliminate hypnozoites, C. Or treat malaria infections, D. 149. What is the primary reason for using combination therapy, such as artemisinin-based combination therapy, ACT, to treat malaria? A. To enhance the efficacy of the drug. B. To prevent parasitic resistance. C. To treat severe forms of malaria. D. To reduce the cost of treatment. Answer: B. To prevent parasitic resistance. Rationale: the use of combination therapy, such as ACT, reduces the likelihood of the malaria parasite developing resistance to the drugs. While combination therapy may enhance efficacy, A, and be useful in severe forms, C. Preventing resistance, B, is the primary goal. Cost reduction, D, is not the main reason for using combination therapy. 150. Which of the following statements about malaria eradication is correct? A. Malaria eradication is easily achievable. B. Malaria is only found in sub-Saharan Africa. C's insecticide resistance is a major barrier to eradication. D. Malaria has been eradicated in many countries. Answer: C. Insecticide resistance is a major barrier to eradication. Rationale: insecticide resistance is a significant challenge to malaria eradication efforts. Malaria is found in many parts of the world, not just sub-Saharan Africa, B, and eradication has not yet been achieved, A and D. The resistance to insecticides limits the effectiveness of mosquito control programs.